Health officials in Wisconsin are testing 4 more people for coronavirus.
It comes a day after we learn there's a case of the virus in Dane County. It's the first in the state. 14 people in Wisconsin have now been tested for the virus. 7 of those tests have come back negative. The Department of Health Services tells us the one confirmed patient is recovering well at home in self-isolation. Now health officials are working to check with anyone that person may have made contact with while they traveled from China to Madison.
If any of those people who are identified as contacts do become ill, they are immediately asked to self-isolate, and they are also going to be tested for the novel coronavirus.
As health officials wait for the results of the other tests, they're dealing with a bigger problem. Francisco Almenara has you covered on the concerns over race and why health officials say it does not play a role in who can transmit coronavirus.
As the first case of coronavirus in Wisconsin is confirmed, officials are urging people not to succumb to ethnic bias. While many of the confirmed cases of coronavirus have stemmed from travel to China, no one race is more likely to transmit the virus than others.
You cannot tell if someone has a risk of spreading the novel coronavirus by what they look like.
State health officials say they've received many calls since the outbreak started and say it's something they've heard before.
I've seen this happen before with the SARS outbreak back in 2003, and unfortunately there has been calls that have come in too that have really tried to blame the Chinese people for this. And as Gene said, it's not where a person has come from or their ethnicity. It has to do with travel and science.
The only risks of infection are if you've traveled to China recently or have been in contact with others who have confirmed cases of coronavirus.
This public health concern will not be solved with fear and discrimination. We will fight it with compassion and with science.
As for the confirmed case, officials say just because you were in the same airport as the person does not mean you're at risk. People at risk would have to come in close contact. So right now, health officials are monitoring people who were in the same row and within 2 rows of the person. Aside from that, everyone else shouldn't be concerned.